Good afternoon, everyone. My name is Maya Luria with TMC for Seniors, and today we are continuing on with our active aging theme, and we're going to be discussing the impact of hearing loss. I have Haley Lanoue here with me. She is a vestibular audiologist with our TMC Outpatient Adult Therapy. How are you today, Haley?
I'm doing well. How are you?
Great. So, Haley, I know you are back to sort of share with us more about what people need to know about their hearing loss and maybe what they can do for that as well. I'm going to go ahead and put your PowerPoint up for you. You do have an online audience that's watching. If you're watching us from home, please feel free, if you've got questions, to go ahead and put those into the chat, and then we'll address those afterwards. Haley, I'll go ahead and turn it over to you.
Thank you very much. All right, so we are talking about the impact of hearing loss today. I, like Maya said, am one of the audiologists here at Tucson Medical Center, and at the end of the presentation is all of our contact information if you need us. So we're going to start off with, according to the World Health Organization World Report on Hearing, about 1 in 5 people worldwide have some degree of hearing loss, according to the 2021 estimates, and that is expected to increase to 1 in 4 people by 2050, which is a significant portion of our population. Hearing loss, at least in the United States, is the 3rd most common chronic health condition, and it's twice as prevalent as diabetes or cancer. And so it's something that a lot of people have, and much fewer people seek testing for or seek treatment or management for. The chances of having a hearing loss increase as we age, which is why we're all here today. It also increases with things like chronic conditions such as diabetes or high blood pressure, with smoking, noise exposure, and there's a ton of other things that can cause hearing loss, but it is more prevalent as we age. Greater than 25% of people over the age of 60 have some degree of hearing loss. And what's even more shocking is, on average, people will wait 10 years from the onset of their hearing loss to the time they seek evaluation or hearing aids or other treatment for their hearing loss. So why this matters is because hearing loss is affecting you. We're going to go kind of more in detail on all of these, but in general, people with hearing loss, especially untreated hearing loss, so people who have not been wearing hearing aids or other devices that are recommended for them, they're at an increased risk of anxiety, social isolation, depression, falls, cognitive decline, and a lower quality of life overall. And especially related to those first few points, I like to point out that hearing loss is primarily a communication disability. It affects how we communicate with others. So one thing to note is this does not necessarily all go along with people who are deaf or hard of hearing since birth and primarily use sign language. This is primarily talking about people who have acquired hearing loss later in life, and spoken language is their primary communication tool. So how does hearing loss lead to anxiety, social isolation, depression? Well, if we're talking about communication, a hearing loss can impact our relationships and our interactions with our family, our friends, our coworkers. When we go to a restaurant or a cafe, when we go to a doctor's appointment, all of those interactions that we have can be affected by our hearing loss. One way it does that is if you have a hearing loss of any degree, it causes an increased listening effort, which can cause increased fatigue. It's just harder to hear So we're using more of our energy to hear, and then we're left pretty depleted after those interactions. It can also lead to increased stress and frustration. It's frustrating when you don't understand someone. It's frustrating for both parties. We've all probably been there, whether it's a noisy restaurant or just your hearing loss is impacting you one-on-one. If somebody is trying to get their point across and you don't hear them and you keep saying, what? Huh? Eventually you just say, okay, forget it. I'm out, right? It's not easy when you aren't able to hear someone. It often leads to feelings of embarrassment, feeling misunderstood, and fear of missing out is a big one. So oftentimes this will lead to increased social isolation because it's harder to communicate with people. People kind of give up and they say, well, if it's hard for me to be in that situation, I'm just not going to be there, which oftentimes is our family gatherings, our time with friends, things like that. And even to the point where if you get to the degree of hearing loss, it's hard to hear your doctor, you might avoid going to the doctor. So all of this together increases the prevalence of people with hearing loss with anxiety, depression, social isolation, and withdrawal. So there's so many studies out there that have been showing this time and time again since we started talking about hearing loss way back when audiology started. But it also just makes sense, right? If we can't hear, it's difficult, it's tiring, it's frustrating. We don't want to be there. It doesn't necessarily increase with the degree of your hearing loss. So just because you have a mild hearing loss doesn't mean you're less likely to get these symptoms. And if you have a severe or profound loss, doesn't mean you're more likely to get these symptoms. It's really just how is it impacting your day-to-day life. So the next one is there is an increased correlation with falls. So there is not yet any studies showing a causation between if you have hearing loss, you are definitely at increased risk of falls, you are going to fall. But there is a correlation that has been shown where people with hearing loss tend to fall more than people without hearing loss. There's a few reasons for this. One is your inner ear for hearing is the same inner ear you have for your balance system. And so if you are losing hearing because of something like age-related changes or certain like medication exposures, things, there's so many different types of things, but especially age-related changes, if they're affecting your hearing, they can be affecting those same cells that are used in your balance system because they're a shared system. And so if we're losing hearing, we can also be losing some sensitive information in our vestibular balance system as well. And another reason that has been proposed is the cognitive resources as well. If we have hearing loss and if it's harder for us to hear and we're using more of our cognitive load to hear, we have less cognitive resources to focus on our balance. Our brain is doing too much work at the same time. So one thing kind of has to go, and oftentimes that's our balance or how well we're walking. And there are more recent studies showing that using hearing technology like hearing aids, cochlear implants, if you qualify for one of those, have improved spatial awareness. So because you can hear more around you, you can hear there's a car approaching over there rather than being startled by it when it's really close to you. Things like that, and thus reducing your risk of falls as well. Again, there's no studies saying this is definitely you have hearing loss, you are going to fall, or if you wear hearing aids, you're not going to fall anymore, but it's showing that there is an increased risk of it. So it's something we should be aware of. And then another one that's been in the news quite a lot recently, which I think drives a lot of people to get their hearing tested, which I think is a good thing, is there are studies showing that there is I'm going to wait for a second. Someone's phone is going off.
Your phone. I turned it on.
Okay. So there are many studies now showing a correlation between hearing loss as a modifiable risk factor for dementia. Essentially, the people who have hearing loss, a hearing loss that could benefit from something like hearing aids or other devices, the people who wear those devices tend to do better in the cognitive studies than those people who are not wearing those devices. So wearing your hearing aids, the trend is people do better cognitively over time. So far, the studies have been about 3 to 5 year studies than the people who are not wearing their hearing devices. And there's many theories for this. We don't have anything saying it is a causative thing. If you have hearing loss and you're not wearing your hearing aids, you are going to get dementia. There's nothing saying specifically if you have hearing loss and you wear your hearing aids, you're not going to get dementia. But again, the trends show that there likely is benefit from wearing your hearing aids over time compared to not wearing your hearing aids when we're looking at cognition. One theory is the cognitive load theory or information degradation. Basically, if you're kind of using more of your cognitive load, your energy essentially to hear, we have less cognitive load to process things and remember things and do all of the other things our brain is trying to do all of the time. So basically, because we have a degraded signal coming in, we're trying harder to hear. One theory is that we're using more brain power for that, so we're just not giving as much brain power to our cognitive abilities. Another theory is the brain structure or function, so our sensory deprivation. Basically, use it or lose it. Our hearing nerve is a nerve that is functioning as part of our brain and our cortical system. And so if we're not using it because we have hearing loss, we're not getting input to that nerve anymore, our brain's not going to pay attention to it. You're going to lose that function. And so our brain is just having sensory deprivation. It's kind of like if you were using your muscles and training all the time, and then you, for some reason, are not training your muscles anymore, you're going to lose that muscle mass. Kind of the same thing in your brain. Use it or lose it. And then the other aspect or other theory of this is the social isolation loneliness. We know that there is an increased risk of cognitive decline for people with depression and social isolation. What can cause those things? A hearing loss. So if we are socially isolating, if we're not around people, we are, as humans, social beings. If we're not getting the input from being around people and having relationships with people or talking with people, or even just being in the same room as people, or if we're lonely, that can lead to depression and that can lead to increased cognitive decline. So there's no study at this time saying a definitive cause of one of those theories, but there are these 3 main theories out there at this time. One of the biggest studies, so I've listed on here several of the main studies that have shown these correlations, starting back in 2011 with Johns Hopkins. One of the more recent studies is the 2020 Lancet review. I'm going to go into that in a second, followed by the Achieve study, followed by the 2024 Enhance study. Those are all kind of building on top of each other, essentially. So in 2017, actually, the Lancet review, which is the Dementia Prevention, Intervention, and Care report. So they're looking at a whole bunch of different aspects of what we can do to prevent dementia from coming on or cognitive decline. In 2017, they came out with this finding, and then in 2020, they essentially confirmed their 2017 findings. But what they said was that hearing loss can essentially account for about an 8% modifiable risk factor for dementia. So overall, dementia and cognitive decline, about 60% of people with dementia are non-modifiable. They're going to get dementia no matter what other things that they do in their life to help prevent it. But about 40% of dementia cases are potentially modifiable, doing other things in our life, like reducing smoking, working on physical inactivity, working on managing our diabetes, high blood pressure, things like that. About 40% of people potentially have modifiable causes of their dementia. And what they've found is that hearing loss is one of the highest modifiable causes in later life at 8%. It's significantly above getting a brain injury in mid or late life. And hopefully you can see it, if you Google the Lancet 2020 review, it'll pop up with a big website about everything. But it's one of the biggest potentially modifiable risk factors. The ACHIEVE study in 2023 was also out of Johns Hopkins. They were one of the first people to start studying this. And they were like, okay, great. You reviewed a bunch of people with hearing loss, without hearing loss, but there wasn't any controlled variables in that. And so they did a randomized controlled trial for people with hearing loss who were treated with hearing aids and people who just had essentially health visits to talk about healthy living, but not treated with hearing aids. And there were two cohorts. There was one cohort that already had a greater risk for cognitive decline, and then there was a healthy volunteer cohort, so people who weren't falling into that already greater risk of cognitive decline. So both of those groups, half of them received hearing intervention, so hearing aids, and half of them did not. They just received education. And what they found was that, I'm just going to read it so I don't mess any of this up, in older adults at increased risk of cognitive decline, hearing intervention slowed down loss of thinking and memory abilities by 48% over 3 years. There are some caveats to the study, which we could go into for hours probably. But in general, it was pretty strong findings showing that the people who were in the cohort that were already at greater risk of cognitive decline, they did significantly better over the 3 years if they had hearing aids compared to those who didn't. Of the healthy control group, there was no significant difference. So if you weren't already falling into that greater risk group, there was no significant difference between wearing hearing aids and not wearing hearing aids. One problem that the enhanced study looked at in 2024, which was also over a 3-year period with two kind of similar but different groups of people. One problem they had with the ACHIEVE study was that the cognitive tests were sometimes given to patients orally. So they were verbal instructions, essentially. Whereas the enhanced study was looking at only giving cognitive tests where they were written instructions. So people's hearing loss couldn't be impacting the cognitive tests, essentially. And they essentially repeated those results. And they said there is, for people who are at greater risk already, wearing the hearing aids showed better outcomes over the 3 years on those cognitive tests than people who did not. Does this mean that everybody with hearing loss who wears a hearing aid will not get cognitive decline? No, it does not. Remember, that group of 60% of people will have dementia whether they modify things or not in their life. Does this mean if you are not wearing your hearing aids, you will definitely get dementia? No, it does not. It just shows us that it's recommended to wear your hearing aids if you have hearing loss, because the chances that you do better over time than if you weren't are pretty significant. So overall, the impacts of hearing loss, there's a lot of potential bad outcomes with hearing loss if you are not treating them. But we've also shown in a lot of studies that treating hearing loss can significantly improve your cognitive or your quality of life. Whether or not you get dementia down the road, you're doing better with your hearing aids than without. People report less anxiety, less fatigue, less social isolation, less depression when they are wearing their hearing aids, oftentimes because they're able to participate in their community again, participate with their family, their friends, anyone else they interact with day to day. And overall, just our studies have shown that it improves emotional health. So regardless of the fall risk and the cognitive decline, I would recommend you to wear your hearing aids, essentially. So if you're thinking, okay, there's all these potential bad outcomes, do I even have hearing loss? What do I do next? The only way to know if you have a hearing loss is to get a hearing test. There's a lot of signs we're about to go over for potential hearing loss, but especially if you're over the age of 55, the ASHA, the American Speech and Hearing Association, recommends that ages 55 and older at least get an initial hearing test to get a baseline of your hearing. So if you have normal hearing, great, we know what it is. So if it changes down the line, or to search for a hearing loss, because oftentimes people don't realize that they have a hearing loss. So some signs of a hearing loss are asking people to repeat what they say, or if you find yourself saying huh and what all the time, or if somebody is telling you that you're saying huh and what all the time, that's a pretty good indicator that you might have a hearing loss. If you think that other people are mumbling or not speaking clearly, the likelihood is that you probably have a hearing loss rather than the world is now all mumbling all the time. So oftentimes people will say, well, my partner just mumbles, my children just mumble. Even if you think that's the case, I would still recommend you get a hearing test. Difficulty hearing certain voices. People will often find that women or children are harder to hear compared to men, or things like the television is harder to hear. People will often say that they can hear speech is happening, I hear it, but I have difficulty understanding it. You're missing some parts of it, or it's lacking clarity, or again, it sounds like people are mumbling. Missing phrases on the telephone, TV, radio, all a good sign that you should get a hearing test. If you're turning the volume up a lot to hear the TV better, especially if your other housemates are saying the TV is too loud, get a hearing test. If you have difficulty understanding in noisy environments, that's often where a hearing loss will show up first, is if you can't understand in a restaurant, grocery store, at the cafe, at the doctor's office, things like that. If you have difficulty following conversations with more than one person, so you do great one-on-one, but the second you're at a group gathering, you can't hear very well, get a hearing test. Or if you're responding inappropriately to conversations. Someone asked you to go to dinner and you said, what's on TV? I don't know. People might say, oh, you completely misheard that, or what are you talking about? Or if you're just having fatigue after difficult listening situations. Other people might think you're ignoring them. They're talking to you across the house and they say, why are you ignoring me? It's because you didn't hear them, usually. Someone tells you that you have a hearing loss is a good sign that you might have a hearing loss. And then other things are pretty much any other ear-related symptoms. So if you have tinnitus, which is ringing, buzzing, hissing, other sounds in your ears, pressure or fullness in the ears is a common one. You might think there's like wax stuck in your ear. Sometimes there is wax stuck in your ear. Sometimes it's something else going on. Sometimes it's just you have a hearing loss and you're missing what you used to be hearing. So it feels like there's pressure in your ear because it's not as clear. Or if you notice a change in your hearing in one or both ears. You used to be able to hear something, but now you can't. So I'm going to briefly go over how we hear so that we can talk about a hearing test and what all of that means. So this is your ear. We're going to look first at the highlighted part is your outer ear, which is your ear canal to your eardrum. We have our middle ear, which is an air-filled chamber. So from the eardrum to the inner ear, there's 3 little bones. It's filled with air, and it's connected to your sinuses through something called your eustachian tube. It's why you get pressure when you go up in an airplane, over a mountain pass, when you're sick, have a sinus infection, anything like that. And then your inner ear has 2 main parts. One part is the spiral guy. I don't know if you can see that. The spiral looking seashell guy is called your cochlea, and that is your inner ear for hearing. And then the other little loops that's sitting right on top of that, that's called your vestibular system. So today we're talking about the inner ear for hearing. Your cochlea takes the sound, travels through your outer, middle, and inner ear, and then the sound vibrates little cells and membranes in your inner ear. It sends the signal to the nerve, and then that gets sent up to your brain. So once your ear has heard sound, it also has to go through a whole lot of different pathways in your brain to know where the sound is coming from. What made that sound? What does that mean to you? And how you're going to respond. Was it the air conditioner that's running all the time that just came on, or was it somebody talking to you, or was it somebody slamming a door, etc.? So we not only have to hear with our ears, but our brain has to process all of that information, and then we have to have an outcome of we're ignoring it, we're going to respond to someone, etc. So a lot of your brain is used in hearing and understanding speech. So what is a hearing loss? Essentially, we break it down into 3 types of hearing loss. We have sensory neural hearing loss, conductive hearing loss, and mixed hearing loss. A sensory neural hearing loss means that there is a loss in the inner ear. It's a permanent type of hearing loss. It is the most common type of hearing loss. It's what we get with age-related changes, with noise exposure. If we're exposed to a toxic medication for our ears, it's called an ototoxic medication. Or just, we don't know why. Sometimes we just have a hearing loss and we don't always know why. But the most common type, especially related to aging, is a sensory neural loss. There's something going on in the cochlea or the nerve causing that loss. A conductive hearing loss is not always a permanent hearing loss. It can be a permanent hearing loss, it kind of depends, but it can be you have wax blocking your ear canal, and then you can't hear because the wax is blocking your whole ear canal, or an ear infection, something else that is sometimes modifiable with usually medical intervention with an ear, nose, and throat doctor. So if we find this type of hearing loss, we'll usually send you on for an ear, nose, and throat doctor evaluation. And then a mixed hearing loss means you have hearing loss in both parts of the ear. Typically, one way we can describe a sensory neural versus a conductive hearing loss is if normal hearing is the large bird picture that's nice and clear and we can see it perfectly, a conductive hearing loss means we just kind of made it softer. It's smaller. But a sensory neural hearing loss is typically the one that results in not only it being softer, but it's not as clear. That's often where the lack of clarity comes from. Is essentially if we treat a conductive loss, we can typically make it louder and sound pretty normal. But treating a sensory neural hearing loss, we can make things louder, but we don't always make it perfectly clear and perfectly audible for people. So you've scheduled your hearing test. What's going to happen? We're going to do otoscopy, which is a fancy term for just looking in your ear. We're going to look for earwax. We're going to look for, can we see your eardrum? Is there any signs of infection? Anything like that. And then we're going to test how well your eardrum is moving. That's called admittance testing, or sometimes called a tympanogram, to see if there's any other signs of infection or fluid in your ear, or if you have a hole in your eardrum. Essentially making sure that outer and middle part of your ear is working well. And then we're going to put you in a sound booth, and we're going to ask you to usually press a button or raise your hand for some beeps. So you're listening for tones, we're going to play like beep, 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 and we're essentially playing it as soft as we possibly can for you to just hear it. So we're waiting for a response, but sometimes you won't hear it. Sometimes you will. We're looking for a threshold of hearing. How loud do we have to make it for you to just hear the sound? And then we're also going to test speech understanding. So when we raise the volume loud enough, are you able to hear speech clearly, or is there still difficulty with the clarity and understanding of speech? And then when we get all that information, we're going to look for what type of hearing loss it is, what the severity is, what it looks like, symmetry, is it the same in one or both ears? And as your audiologist, that's going to determine whether we say proceed with hearing aids, or if I say you need to see an ear, nose, and throat doctor first, or do something else before we proceed with that. So this is a common hearing test. This is not this isn't anyone real, I made this up. But this is what kind of typically the shape looks like, where often people who are presenting with age-related hearing loss or noise exposure-related hearing loss have better hearing in the low pitches and worse hearing in the higher pitches. So if you're looking at the graph, can you see this? No. Okay. So if you're looking at the graph on the left side, going left to right is low pitches to high pitches. So bassy tones to treble tones. And then from top to bottom, we have very soft sounds up to very loud sounds. And this graph is broken up into different grayed out sections, and that is describing the severity of hearing loss. Anything in the top white section is considered normal hearing, which is anything above 25 decibels. So if it's from the line of 25 or above, it's normal. Anything below that is considered a hearing loss, and we break it down into categories of mild, moderate, moderately severe, severe, and profound hearing loss. So typically, people with age or noise exposure will lose the high frequencies first, the tinny sounds. Things like the letters F, TH, S, SH, K, those softer sounds of speech, which are often the consonants of speech, and they make up a lot of clarity of speech. What you see on this graph here is the average speech sounds in the English language when spoken at an average volume 1 meter apart. So this person's hearing loss, this imaginary person, anything below the blue and red lines, they'd be able to hear. Anything above those lines, they would not be able to hear. So that means this person can hear the low bassy sounds, which are often the vowels of speech, the O's, the middle of the words, essentially, the volume of speech, the oomph of speech. But they are not hearing the S, the TH, the F, those soft consonants of speech that make up a lot of the clarity. So once you get this information, we would essentially talk about what you need to do next. Is there signs of an infection? Do you need to see an ENT, or can we proceed with hearing aids? One thing I always like to talk about is prevention of hearing loss. A lot of hearing loss we cannot necessarily prevent because it's going to happen whether we do anything or not because of aging, genetics, all of that. But one thing we can prevent is noise exposure. And a lot of us have already had a lot of noise exposure in our lifetime. And unfortunately, that noise exposure is additive over our time. Our ears don't forget that we've heard all of that noise before. We're gradually getting more and more damage from the noise exposure over our lifetimes. So from here on out, what you can do is limit your time spent around loud noises. And you can do that by just not being by them. So, give up the lawn mowing job to a neighbor down the street, or using hearing protection. Hearing protection, you can use those little foam earplugs that go in your ears. Always make sure to roll them up really small, pull your ear back and shove it in as far as you can. You should notice a difference when they've expanded if you are still hearing the same, they're not in properly. I think the easier ones to use are the ones that go over your ears, like this. And you can usually get them at like Home Depot, Lowe's, anything like that, anywhere they sell power tools, essentially. One kind of rule that I use is anything that's louder than a hair dryer, I'm going to be wearing hearing protection for. Even if you think a hair dryer isn't that loud, it's possible that you already have some hearing loss. And so still use that same reference point. Anything louder than a hair dryer, you should be wearing hearing protection for. And then if you are a person who uses headphones a lot, listening to music in your earbuds, which is often more for younger generations, but if you are, if you're going to be listening to it for longer, like multiple hours at a time, don't go above like 60 to 70% of your volume. The longer you're wearing that sound, you should be decreasing the volume. If you're only listening to it for a few minutes, you can get away with a little bit louder, but there are levels of noise that can cause instant damage to your ears as well. So I've given you some reference points there. So you have a hearing loss. What do we do about it? One common thing which most people know about are hearing aids. They are designed to improve the audibility of sound to give you the best opportunity at hearing and understanding speech. They essentially amplify sound at the different pitches where your hearing loss is. It will be specific to you and your hearing loss and your hearing test. And when we amplify those sounds, we're giving you the best opportunity we can to understand the speech. If your ear and your hearing loss is still having difficulty with clarity, you did poor on that word understanding test, you'll likely still have difficulty with the clarity, but we're going to give you and your brain the best opportunity at hearing the speech to do the best with what we have. Other things that can be a little bit cheaper or more generally available are something like a pocket talker, which is basically a little device that you can purchase. Sometimes like doctor's offices will have it for a patient to use in the appointment. It's just a little microphone connected to headphones, and it just amplifies everything really loud. It's not specific to your hearing loss. It's just turning the volume up on everything, which is really great in a pinch. Hearing aids are preferred because they're going to be specific for you and your hearing loss. Another option, if you have significantly poor word understanding or severe to profound hearing loss, you might qualify for something called a cochlear implant. It is a surgically implanted device into your inner ear, that cochlea, and we essentially replace the structures that are not working with an electrical signal. So when you hear sound, it triggers the electrical signal in that inner ear to send directly to the nerve, essentially bypassing the inner ear part that's not working. That's the only thing that can improve your clarity or your ability to understand speech. But you do have to qualify for them. They are a surgically implanted device, but they are a possibility for some people who can't hear very well with hearing aids. It's essentially, we've maxed out on your ability to use hearing aids, so now we're moving to the implanted device. Bone anchored hearing aids are less common, but they're for typically people with either a unilateral, so one side hearing loss, or people with a conductive hearing loss. Other things that can help are oral rehabilitation. There are some programs online and through various resources where you essentially train your brain to listen in background noise. One way to do this on your own is to get an audiobook, like an audiobook form and a book form of a book, and essentially read the book while you're listening to it to train your brain to say, okay, this word sounds like this. So you're retraining your brain to hear. And then communication strategies are my favorite thing for everybody with or without hearing loss, which we'll get to soon. I forgot to put those later. So I already talked about hearing aids. Yeah. And we like hearing aids. We like to treat our hearing loss. especially talking before about the impacts of hearing loss. These are something that we know help improve our quality of life. So communication strategies. One, first and foremost, face the person you're talking to. If you're looking away from the person, even if your head is just turned over here, but usually when you're across the room or someone's doing the dishes and someone's watching TV, you can't hear. You aren't going to hear that they're starting to talk to you. You're not going to know they're talking to you until they're finishing up what they've said, and then you're going back and forth. So face the person you're talking to. Get their attention, have them get yours. Be in the same room. Reduce noise if possible. Mute the TV, turn off the sink, things like that. Minimize distractions or multitasking. And then another one, a good one, is just inform the speaker or the person you're talking to that you have a hearing loss. Advocating for yourself is not always easy, but letting people know that you do have difficulty hearing can often improve that situation, instead of just saying huh and what and repeating the same thing over and over again and never getting anywhere. Asking someone to rephrase what was said is one of my favorites. So instead of saying repeat that, they're going to repeat it and they're going to say the same thing again and you're going to miss the same thing again. Having them rephrase what they said. Can you say that in a different way for me? Gives you more context clues. It gives you a better chance of understanding. And then asking people to speak slower, especially younger people. Ask them to speak slower automatically makes them speak clearer. If you tell someone to enunciate, it's going to be weird. You're not going to understand them well. People don't do well when they're told to enunciate. But if you ask them to speak slower, it's pretty universal and it's a lot easier to understand. And then confirm what you did hear. So repeat back what you heard just to make sure you're both on the same page. And then this one is for the speaker, so the people that you are talking to. So if there's someone that you regularly have difficulty communicating with, you can go over these together. So make sure that they're getting your attention, looking at you, reducing noise, rephrasing, all of that. And so from a hearing test, treatment is going to vary depending on you, your hearing loss, what other symptoms you have going on, and there can be so many different things, but a hearing test with an audiologist is a really great place to start. Why I recommend a licensed audiologist: there are people that can do hearing tests called a hearing aid dispenser. The hearing aid dispenser is going to be doing a hearing test specifically to fit your hearing aids, which is great, but an audiologist is going to look medically and say, are there signs of infection? Are there signs that something else is going on here that needs addressed by an ENT? Are you a cochlear implant candidate? Is there a difference between your ears? All of that. So an audiologist is recommended for your hearing test especially. An audiologist is also going to ensure that your hearing aids are properly fit. We are going to do tests called real ear measures, where I put little tubes down in your ear canals and I measure what the hearing aids are doing actually on your ears and not just what the computer says they're supposed to do. I'm measuring what they're actually doing to verify their function. And then I'm going to work with you time and time again to make sure that they're working well. Are they staying in your ear? Are you actually wearing them? Is there something wrong with the sound quality that I can adjust to make this more comfortable for you? Yeah, we can also use them for tinnitus management as well. I've done a previous video on tinnitus management if anybody wants to go search for that somewhere. And I'm sure I'll do one in the future. But hearing aids are often used for tinnitus management and more, but I do recommend an audiologist. Hearing aids are not cheap, and they're not always covered by insurance. They are not covered by Medicare. And so unless you have a supplemental plan, if you're on Medicare, and only certain supplemental plans have it, you might not have hearing aid coverage. They're not a cheap device. We do hearing aids here at TMC, and we work with a number of insurances, but it's not a cheap device at all. They typically last on average about 5 years. and they require several appointments to make sure things are working right and to make sure you're hearing well. And if your hearing changes, that we reprogram them and all of that. So if you are unable to afford hearing aids, I think it's important that you have resources for that. And so I've listed a couple of low-income hearing aid options for you around town. One is with the University of Arizona, the Community Outreach Program for the Deaf and the Hearing Aid Bank there. And then one is through Grace Hearing Center. But we also have a variety of pricing and things like that at TMC, and we're always happy to do a consult with you on hearing aids as well. So that leaves us with how to find us here at TMC. We're at the Atrium building, which is on the northwest corner of Grant and Rosemont. We do require referral to be seen for your hearing test. So you do need a referral typically from your primary care provider. But then once that's in, you can call us to schedule. Our phone numbers are there. We have 5 doctors of audiology. We serve all ages from birth to end of life. And we do comprehensive evaluations. We work with hearing loss, hearing aids, cochlear implants. We work with everything. Yeah. Any questions?
Do mine's questions first.
Yeah, thank you so much, Haley. So I do have a couple of questions that came in. Do you think that we'll see hearing loss or maybe hearing loss developing at later stages in life due to better regulations in workplace environments and better protective equipment?
So the question is, do we think we'll start to see hearing loss like develop later with the better workplace protections?
Yeah, or yes. So
For
that
noise
you don't have
exposure?
it as early on, sort of in life.
I think it's possible. A significant population has hearing loss due to noise exposure. So I think it's definitely possible. We might start seeing it start later on. I don't know for sure because everyone ages at different rates. And so I don't know.
Okay.
Hopeful.
And if you use Q-tips, I know that this is always something about, cleaning your ears. How much are you increasing your risk of developing hearing loss early by using Q-tips? And what can you do to keep your ears clean of too much wax if you're not supposed to be using Q-tips?
Okay, the Q-tip question. Part of that question was, does using Q-tips increase your chance of hearing loss? And then also, what can we do to clean our ears that's not using Q-tips? Using Q-tips is primarily dangerous for a couple of reasons. One, because it really just pushes wax further into your ear canal, and then it builds up, and then it's going to block out sound. But once the earwax is removed, your hearing will return to whatever your hearing is in your inner ear. So it is a reversible type of hearing loss if you get hearing loss from a Q-tip. The other risk is kind of worst case scenario, but I know personally 2 people that have done it, are you're using a Q-tip and somebody bumps into you, or the dog runs under you, or a door opens and that Q-tip goes through your eardrum, and that can cause irreversible damage from damaging the bones, the inner ear structures. It can be bad. Don't use a Q-tip. The other reason is Q-tips are pretty abrasive. It's kind of like rubbing a cotton ball on your arm all day long, and our ear canal skin is really thin. And so especially as we age, our skin tends to get thinner as well. It's really like a thin layer of skin on bone. And if we get a cut in there, it's very easy to get a cut from a Q-tip. If we get a cut in there, because the skin is so thin, it's not easy for it to heal on its own. So we're at risk of infection and risk of bleeding and risk of all sorts of stuff, especially if you have diabetes or if you're if you're on blood thinners or anything like that, it can be even worse. So a number of reasons to not use Q-tips. That's my soapbox. And then what can you do for earwax and cleaning your ears. Most people don't need to clean their ears. Your ears are going to naturally, as your skin sheds, the skin actually travels further from the inside of the ear canal out, and it brings that earwax with you. So you really just have to take a tissue and wipe it out for most people. Other people might need to go see their primary care or an ear, nose, and throat doctor to get that removed manually. Sometimes just once in their life. Sometimes people have to go repeatedly every 3 to 6 months. It kind of depends. Or there's also ear lavage kits. If you've never had any ear infections or any holes in your eardrums, you can use essentially some earwax softening drops and let them sit for several minutes, let it drain out, and then rinse it with some lukewarm water. I always recommend doing that seated over a sink or a bowl because the water in your ear can make some people dizzy, and so you don't want to be standing up doing that or in your shower doing that. I always recommend sitting down doing that one. But that's also for people who don't have ongoing ear infections or anything like that.
Okay, great. Is there technology today that significantly reduces noise?
Is there technology that significantly reduces noise? Hearing aids are designed to reduce noise. Can any hearing aid, no matter what they advertise, reduce all background noise? No, because physics. Sound is coming at you from all sides all the time and reverberating. And say you're in a restaurant, the hearing aid might not necessarily be able to pick out the person you want to talk to compared to their utensils on their plate. It tries really hard at doing that, and a lot of them have gotten a lot better, especially in the last 5 to 8 years. They've gotten a lot better at their noise reduction, and that's what they're always working on. Every new hearing aid coming out is, we've improved our noise reduction. So yes, it can significantly reduce noise or background noise, but it will never fully eliminate background noise.
Okay. Now, somebody's asked, what hearing aid is best, regardless of cost, that has a low noise to signal ratio? And this is somebody who is using Resound. So they're asking how that compares.
They are asking what hearing aid brand or what hearing aid is best. That is so individual. We work with essentially all of the main hearing aid companies at TMC. And I could not tell you that this hearing aid is best because that hearing aid might be best for that person and another hearing aid might be best for another person. So they all differ in their various ways. I can't say what the best car is because there's so many different cars and models.
Okay. Yeah. So it's very subjective then as to which one's going to work for you from the sounds of it. Okay.
And the best hearing aid is the one that you are wearing.
Good. Okay. Well, thank you. All right. I just want to wrap up by resharing also the information. I know you need a referral for an appointment with TMC Audiology. To schedule an appointment after you have your referral, it's 520-324-2075. So again, 520-324-2075. There's a team of, is it 5 audiologists, Haley?
3 full-time and then 2 part-time audiologists. Yes.
Great. So so feel free if you're interested and would like to have, like to see an audiologist. They are also located over in the TMC Atrium building, which is on the northwest corner of Grant and Rosemont. So I want to thank you so much for being here today, Haley. And I'm going to wrap it up with our online audience and I'll turn it over to you. So thank you. Thanks again for being with us today. We look forward to having you back. Our next talk is going to be Handle with Care, Preserving Your Family Treasures. That is Thursday, January 22nd at 10 a.m. So if you're interested in that class, please give us a call. The phone number is 520-324-1960. We hope to see you again soon. Thank you.